You're listening to In Sickness, a podcast about caregiving with Allison Breininger and Justin Bima.
Hi, Justin. How are you?
I'm doing okay. I think I said that last time too, which has been good. I've been kind of reflecting this week on like how I feel this winter compared to like the last couple winters.
Oh, yeah.
And I'm feeling like noticeably better than the last two winters went. Like I'm not 100%.
Sure.
But yeah, that just feels good to like be able to obviously tell that I'm in a better place than the last couple of years at this time, because winters aren't easy historically with a lack of light and all of that, and just my general depression as well. So that's been encouraging. So
do you have any reason, do you have any thoughts about why that might be?
I've had some medication changes, so maybe that's playing into it. Other than that, I'm not sure.
Yeah.
Just sometimes things ebb and flow.
Right. It's so wise of you to kind of look back in that way, because I think so often we just are like, whoa, it's hard right now. And you could still say that, because I'm sure you're maybe potentially like less happy than you are in like, say, May or June, right?
Yeah.
But instead of saying like that, to be like, oh, actually, I feel better than I did a year ago or whatever. Like, I think that's really like wise for, reflection to do and to also then think about like, okay, what is that? And, all of that. So nice.
Yeah. And I mean, it's helpful, like hopefully not inevitably, but things very likely may swing the other way.
Sure.
Over the course of the next years. And it's again, then like being able to look back and realize that things are not always this way and have not always been this way. That's also important, I think, too. So hopefully that can be there if need be in the future.
You're so wise. So wise.
Well,
and I think also for you to not just always be like, winter is the worst.
Yeah.
And I'm always unhappy in winter, but for you to realize there's like, gradations of that.
Yeah.
I think is important. So, yeah.
And winter, there's some good in winter. Like a lot of my favorite birds come down in winter. So like there's great birding in the winter around here. Like we get all these ducks and geese from the Arctic and such that come down to winter here. And so it's one of my favorite times to go out birding. Even though the weather isn't always that accommodating.
Right.
But yeah, it's not all bad.
It's not all bad.
Yeah.
It is, we still got a little bit of time left in this whole winter thing, but
yes. Yeah.
Although here they said, I was thinking this the other day, side note, that like we must be getting older, because I feel like we talk about weather a lot.
Right.
But it does impact us. So
it does.
There's that. We are about to, like, as of today, it's going to be like 20, and then it's going to be like in the 30s the rest of the week, which is like 30, 40 degrees warmer than it was last week.
Right.
And I think they're saying that maybe that was it. Like,
that's
we're
your winter?
done with the cold. I don't know.
It feels like, how do they know that when there's months of winter to go?
But like, if that's the case, cool.
Yeah.
I can do 35.
Right.
Yeah.
Great.
Although part of me, because I love the Higgy, so much.
Right.
That sometimes I like it when it's extreme, because then I'm like, welp.
Yeah, you got to stay inside and be cozy.
Inside. Must be cozy. Cannot go out there.
Got to be the bear from the Sleepy Time Tea.
Yes. Yeah. Yes. That's basically me. Mm-hmm.
Yeah.
Yeah.
So, how are you? I kind of have an idea based on what I've gleaned from your past week. But
2 weeks, actually.
2 weeks. Okay.
Yeah. Pretty rough, actually. Yeah. So I think that, maybe our conversation for today is just, talking through what's been going on for the last 2 weeks. Because, we've talked on here before about sort of the before, during, and after of like medical appointments.
Right.
But I just went through a whole before, during, and after of hospitalization of Sean. And I think there's a lot to talk about there too.
Okay.
So, yeah. I think before we actually dig into that, I will just say too that before the week of the hospitalization, we had a really crazy week that would have been enough to like knock me flat.
Right.
And did, actually.
Yeah.
So like the week before, he had a day on Tuesday where he had like 8 hours of Mohs procedures.
Oh, man.
And it was just terrible. And then on the Thursday of that same week, he had another one of his esophageal dilations, which went super well, but it was like, be at the hospital at 5:30 in the morning and, all of that. So by Saturday of that last week, like a week ago, I was like toast. I was just like burnt to a crisp. I was like, this is, because I was sort of had come down from the terrible of those 2 days. And I was like, I was texting with my mom. I was like, Mom, I'm so burnout. I'm so burnout. And she's like, it's okay, you're just rest and, all the things. So, so that was Saturday night a week ago. And then in the middle of the night, and this is like, I think caregivers will get this. Like I could just sense that something was up with Sean. Like he wasn't like, he did actually get up. He's so tiny. He always wears like a bunch of pants, like layers of pants. And he got up in the middle of the night to like put on extra pants. But I didn't really think anything of it because it was like 5 below or something.
Right.
But then I could sense he was just kind of like making a weird noise. And I was like, are you okay? He's like, I don't know. My throat kind of feels weird. And then I tried to feel his forehead, but he has all these layers on. And so I was like, just for fun.
Yeah.
I'm going to take your temperature. And this is like 2:30 in the morning, right? Classic.
Right.
Classic middle of the night. And keep in mind, this is like 5 hours after I had just said, I am burnt to a crisp. I am toast. I'm done. Right.
Yeah.
So it's 2:30 in the morning. I was like, just for fun, we're going to take your temperature. And it was 101.6. So like back in the day when he had the bone marrow transplant, like 100.5 was like the magic number of like, if you get over that, you got to go to the ER. But we've like been out of that zone for a while. So I was like, okay, we're not going to like rush it. But so here we are in the middle of the night. He had just had these 4 skin procedures. So I'm thinking, are they infected? So it's 2:30 in the morning and I'm like redoing all of his bandages, trying to like look at them to figure out, are they infected, trying to feel them to feel if they're hot. Of course they're hot because he's hot, giving him Tylenol and then just trying to make the decision about like, do we go to the ER? Do we call someone? Do we go back to bed?
Right.
All of that stuff. And so in that moment, he took the Tylenol and he's like, let's just go back to sleep.
Okay.
And we'll just see what happens. So we did. And then when he woke up in the morning, he was like, oh, the fever broke. And I was like, oof, okay, good, cool. Little blip. Like, dodge that.
Back to rest.
Back to rest. But then a few hours later, the fever came back. So then it turns into, and he's like, of course, in that moment, like he doesn't feel well.
Right.
Right. And he's also not going to be the proactive one to be like, let's call the people. Right. So then it feels very much on me to be like, it's my job to figure out like, who do we call and who do we ask and da 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 da. So I'm fortunate that I have a good friend who is a nurse who is just like always on call for me.
That's great.
So I texted her. I was like, here's what we're dealing with. He had 2 different procedures. Now he has high fever. What do you think? So then she was able to say like, okay, that fever is too high for like a derm infection, probably.
Oh, okay.
Which is helpful. But then she was like, what other, tools do you have in your house? So of course we've got them all, right? Caregivers, you get this. So I get out the blood pressure cuff.
Right.
And then we have a pulse oximeter, right? So I'm just like gathering all the data.
Yeah.
And taking pictures of the numbers and sending the numbers to her. And then she was like, his heart rate's really high and, and doing all these things. And then trying to decide who do we call and because of course it's Sunday.
Right.
Right. So there's also that. And it's the day before MLK, which I was like, I don't know if that's going to impact things, like if that means things aren't going to be open tomorrow or whatever.
Right.
So called like the hospital number and then the hospital transit. I would like the fellow on call or whoever. Right. And then, they're like, okay, if it's been 20 minutes and they haven't called you back, then call us back. So, of course, this was 20 minutes and then they haven't called back. And then I did it again. And then, and it's just this waiting. And of course, in the meantime, I'm looking around the house thinking, okay, we're probably about to go to the hospital.
Right.
Like, what do we need to do?
Yeah.
Which means, what should happen? That Winston should just like throw up everywhere. That's totally what should happen in that moment. I was like, he never throws up. And I'm like, what is happening?
Right.
So like Winston threw up everywhere.
Oh my gosh.
So then I'm just sort of trying to like, like, do I pack a bag? Am I wasting time? Should we just get in the car? Should we, all the things. And a friend had just very sweetly brought us food and flowers and all this stuff. So I'm like putting like flowers in a vase and I'm like, oh my gosh, like what is all this? Right.
Right.
So I got finally the fellow called and then I started sort of saying, here's the things. And like, 15 seconds in, he's like, you got to go to the ER. So then like I have to go tell Sean, like we're going to the ER. He's like, no. I mean, he knows we need to, but he's like, that's the last place. Right.
Yeah.
So anyway, I'm just rambling over here. So I'm going to pause and ask, do you any follow-up questions or any comments you'd like to make so far?
Yeah. I appreciate having this conversation because the ER is not, well, there have been several times I've had to take Sarah to the ER. Like it hasn't, I feel like it's probably, you have more experience there than we do.
Mm-hmm. I'm glad for you that is the case.
And I'm sorry that your case is how it is. But the few times, like, I can empathize with that. Like, do we go in or do we not? How do we make that decision? Feeling so much pressure as the caregiver that you ultimately are trying to make this call, and like you don't want to seem like you're overreacting. You don't want to like turn it into this whole thing when it just, they send you back home. Just know, it's rest or whatever. So yeah, I can see how just this far into your week, like, that's a lot to be dealing with.
Right. Well, the ER is like the worst place.
Yes.
Right. And then, like, are you going to get other bugs while you're sitting in the ER?
Right.
And are you going to be there for a billion hours? And are you going to be waiting? And, and it's like so terrible. And especially if you don't feel well and then you're like in the lobby. And so it's like, like you don't want to have to go. We also don't want to be dumb and not go.
Right.
And he's very rarely in his 12 years of sickness has he said, I need to go.
Right.
He's much more one to be like, I'm fine. I just really would rather stay here,
Yeah.
And so then it really feels like it's on me. And that feels like that's a lot of pressure, So of course, when the fellow says go, like that helps in a way.
Yeah, for sure.
Right. But even the like, who do I call and should I call? And you know what I mean? All of that is a lot.
Right.
Yeah.
So you make the decision, we're going.
Yep.
Do you have, you've had to do this a number of times, and you don't necessarily know how long you're going to be there.
Right.
Is this going to turn into a hospital stay?
Right.
Do you have a sense, like, do you have a bag that you grab?
Yeah.
How do you prepare not knowing like what this is going to turn into?
Totally. Yeah. So a little backstory is that like 5 years ago now, this happened all the time.
Okay.
That he would get like all of a sudden big fever and we would like have to go to the ER. And then it was turning in that it was like a UTI because he has a urostomy pouch because he has no bladder. So he doesn't know that he has a UTI. And so then we would go and then they would eventually like, and so this is a caregiver tip. If a person is considered septic, if they have 2 of the 3, if either like their blood pressure, their heart rate, or their temperature are high.
Okay.
Or low, like are off.
Right.
And so, and that just means like there's an infection that's like going through your body and this is a big deal. Right. So this used to happen a lot and we used to have to go to the ER all the time. And then they put him on this like rotation of antibiotics.
Okay.
The infectious disease department, like the head of the department, like spent like a day basically trying to figure out like how to crack this.
Right.
Came up with like a rotation of antibiotics for him that he's been on ever since.
Oh, wow.
And so we have not been to the ER in this way since then, but it used to be something we did a lot.
Right.
So we have not, I do not have a go bag.
Okay.
Because it's been a long time since we've done this.
Right.
But there are these things like because he has the urostomy, if he ends up staying overnight, they hook it up to like a Foley bag. And so there's this little like connector.
Oh, okay.
That they can never find. And it's always like, I don't know, what floor would that be on? And how can we find it? And all the things. And so that's always the thing that like for a long time, I carried one of those in my purse at all times.
Wow. Yeah.
And now on this day, I just said, all right, I'm going to put one of those connectors in my purse because that's what we're going to need.
Right.
And so I threw that in there, phone chargers, meal bars, earbuds. I didn't bring clothes for him, which I wish I had because I sort of felt like that was like tipping the scale. That was sort of like saying he was going to stay.
Right.
Do you know what I mean?
Yeah, I get that. Yeah.
So I didn't bring clothes, although I should have. Water bottle. Yeah, those are kind of the big things that I just sort of threw in the bag and I was like, okay, off we go. But here's the other thing. We have a child. Right.
Yeah. Right.
And so then also thinking about that and thinking about our little, was it our last or a couple of episodes ago with the psychologist who talked about the impact this has on all the family members.
Mm-hmm.
Right. So then I have to say, okay, so here's the deal. We're going to the ER. And even like when the dog threw up, I was like, oh, I could really use some help, but I didn't want to like freak her out too much and be like, I'm freaking out. I need your help. So I just was like, hey, Winston just threw up and I'm dealing with a couple things. Could you just take care of that? And then so I tried to be super chill and just be like, here's the deal. He's got a fever. We're going in. I don't know when we'll be back. Call me when, you know what I mean? But that's a whole extra layer.
Yeah.
Right. Is like kind of wanting to panic and wanting her help, but then not wanting her to see me panic. And then, even wanting to call my mom and be like, Mom, come over here. But then be like, ooh, like if Maya sees that my mom shows up at the door, she's going to be like, whoa.
Yeah.
So all of those things are playing in my mind as well, as I'm trying to like get us out the door,
Right.
Yeah.
So you get there.
So we get there. And also like we get there to this place where we have so many memories, right? So then there's that.
Right.
A good thing is that the ER has been remodeled in the last few years, which is amazing because we had a really terrible traumatic experience in the ER at one point, and it doesn't look like that anymore. So that feels great. So we have been to this ER, but like, still. So just like pulling up to the place, I'm like, oh,
yeah,
but I walked straight up to the front desk. I said, I have a cancer patient with a high fever and a high heart rate. And she was like, okay. And then boom, in we went. So we went.
Is that seems like a caregiver tip kind of thing? Like, is that hot? How did you learn to like the magic words?
Well, I think, and sometimes it works and sometimes it doesn't.
Okay.
Right. But I think that especially because what they heard in that sentence was sepsis.
Okay.
Right. When I said high heart rate and high temperature, that's what they hear. Okay. Right. And that sepsis can go bad real fast.
Right.
And so I think that it was those keywords. I think if I had been like, my husband has cancer, which is also kind of confusing because if they were like, what kind of cancer? I don't even know how I would have answered that question. All of them. I don't know. Because he's not like an active treatment and all of that, Right. But I think if I had been like, my husband has cancer and he just isn't feeling so well, they would have been like, cool, have a seat.
Yeah.
Or if I just said like, he has a fever, like he had an endoscopy and he has a fever. So I think it was the combination of those things.
Right.
Of knowing to say that. I think if you say anything, hopefully about like if your person has a compromised immune system, right?
Right. Yeah.
They really should not be sitting in that lobby.
Yeah.
I think typically like if you say something like chest pains, shortness of breath.
Yeah. Right.
Right. They're supposed to, or any kind of stroke, anything.
Right.
I'm not telling you anybody to lie. I'm just saying that these are the things I think that sort of fast track you.
Yeah.
So it's hard to know if that's exactly why or if this would have happened anyway. But like we went immediately, I didn't even sit down. We went immediately into triage and then immediately into a room.
Okay.
And then they just like boom, 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 started checking all the things. But then a strange thing from like sort of a equity perspective is like then watching other people end up on gurneys in the hallway. And be like, wait, why are we in here? And he's, I'm glad.
Right.
But like they're on a gurney in the hallway. Yeah. And then just the trauma of that, of like, it's like being in the middle of an ER episode, like a Grey's Anatomy episode.
Right.
Right. As you could hear everything. Like you could hear the ambulance bring in this person and then be like, okay, ma'am, what happened? And she's like, I don't remember. And it's like, oh my gosh, I can't be absorbing all of these traumas of all the people who are coming in here. And then I almost felt kind of guilty that we were in this like lovely little, I mean, not lovely, but like we had our own room.
Yeah. Right.
So yeah, they immediately just like boom, 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 like started doing all the tests to check for all the things. At one point a nurse was like, what else? Tell me about the rest of your medical history. And it's like, so we did just sort of say, well, this and then this. I mean, because it's all in the same, like it's in the chart, but like nobody can read that whole chart,
right.
So I'm like in this, and then I just start like listing things, and she just is like, oh, I'm sorry. And I'm like, well, thank you.
Yeah.
Question mark. I don't know. So I think that's another piece for caregivers is like in that moment, like we are the medical history.
Yeah.
Right. He's feeling lousy. It's hard for him to stand up or to speak up and to say this happened and this happened and this happened and this happened. And you should know that I have a G tube, that I have a metal hip, that I have a urostomy, that I have a, you know what I mean? Like, and so I think that's such a huge part of the caregiver role in that moment.
Yeah.
Is like the medical history, but also like the comfort thing. Like I'm the one that's like, do you have a warm blanket? Like he looks a little paler than he did 5 minutes ago. It's been 10 minutes and you said you were going to this, you know what I mean? Like that advocacy role. So like, as we sit there, we have this big job to do. Like we're on alert.
Yeah.
Like at one point a doctor came in and she was like, well, we looked at your urine and it actually looked great. And I was like, oh, okay. It's interesting, but surprising, but okay. And then a little bit later, I saw the nurse like collecting the urine sample. And I was like, wait a minute. Hold on. That doctor said the urine looked great, but you haven't given her any yet.
Right.
What is that?
That's
sus, as the kids say.
Yes.
So it's just that advocacy, like being on alert.
Yeah.
Are they doing their job? Are they saying all the things? Is he doing? Are they seeing all of that? Yeah. Go ahead.
I just wanted to back up to, you were talking about the medical history stuff and having to be that record. I think that could be a great opportunity as a caregiver to like document that once. Yeah. And if you do have a bag or a thing that you grab when you go, and this applies to new appointments with new providers as well, like not necessarily, I mean, yes, maybe you can just hand it to them, but so that you don't feel like you have to store all that in your brain. Right. That you have a checklist to go through so you don't miss something. Sure. Just as a takeaway, I could see that being incredibly useful. Did you have that for a while? We had that for a while. We put together a binder when we were trying to figure out what was going on with Sarah, and we had tons of stuff in there, and we had like her whole, because this kind of started off, she had like with a migraine that just went on forever and ever and ever. And she was like going through all kinds of drugs for that, medications. And like a lot of those are like weird off-label uses. Yeah. And so we had like all of that documented. So we knew what she had tried, why it didn't work, and like all the different people she had seen. And so, we would take this binder with us to appointments, and that way we could, have you been on this? Well, I don't remember. Let's look. Yeah. Right. Or what year did I don't know. Exactly. Yeah. You know how many things I've been through since then? I don't know what year it was. Well, and also because you have to repeat yourself so many times. Right. So if you give the whole history and then like 15 minutes later in walks a different doctor who says, so what brought you in today? Really? Yeah. Right. So that's a really smart idea, because it also makes me think of, remember like 5 minutes into COVID, it was like March 19th or something. And Sean had to go to the ER. Oh, okay. Yeah. And it was one of those, we were so new into COVID that I remember driving him and saying, are they going to let me in? Yeah. And he said, you need to be prepared that they won't. And I was like, well, they have to let me in. So I was just ready to like bulldoze my way in, and then we pulled up to the ER and they like came out in like hazmat suits, like wild. And have any of us processed this like dystopian world that we have gone through? No, I don't think so. Okay. Anyway, they came out in hazmat suits and they were like, okay, well, you can drop them off. I was like, because the sign said no visitors. Yeah. And I said, I'm not a visitor. I am his wife. Yeah. And they were like, I'm sorry, we can't have any visitors right now. And so fortunately for us, I mean, he had like some kind of infection at that point. Yeah. Well, he was lucid. He was conscious. He could say those things, like his medical history. But I think about like my friend who like 3 days later at the same ER, her husband had a stroke and she had to drop him off and drive away. Yeah. Right. So you just think about like that little sheet, right? For those of us who have these complicated histories of like, if that happened and I had to like send him in, because even if is conscious and lucid, he's not in his best headspace to be able to remember all these things. So I think having a sheet like that or a binder or whatever, or a top, if you only know 5 things about him, here's what you should know. Right. Yeah. I even think at one of his recent procedures, I saw on the screen this like a little like trace of a body. Right. Oh, yeah. And then it had these little pictures. And I was like, is that a picture that shows like all the things that have happened? And because I was like, that would be brilliant. Because people are always like, so how frequently do you urinate? I'm like, he doesn't have a bladder. Right. Clearly you didn't read the chart, And so like,
And so it looks like they're starting something like that. But I think even something like that, like a picture of the body that says like metal hip here, urostomy here, G-tube here, tongue thing here. You know what I mean? Like just so that at a glance they can see that, because I know they can't read the whole chart, but still, you know. So anyway, I think that would be something like that would be good for a lot of different situations.
Right.
Or if they're traveling or, you know, whatever, like, so yeah, good tip. Yeah.
Okay. So you're in the ER, and I mean, not to spoil where this is going. Yeah. But there comes a time where it's clear that he's going to stay at the hospital. Yeah. Like, how does that transition happen? Yeah. What do you go through at that point? Yeah. What does that feel like?
Yeah. So that was interesting because we hadn't seen anybody for a while. And this doctor walked in the door, but like I keep thinking about this moment. He didn't even like really walk in the door. He like literally had 1 foot in the room. 1 foot. And I don't know if that's because he was supposed to like technically gown up and didn't want to or whatever, but like he just stuck his head in and said, "Hey, I know you've been asking if you can have food and water. And the answer is no, because tomorrow morning they might want to do a procedure." And I was like, "So what you're telling me is that he's staying the night?" And he was like, "Oh, well, no one's told you that yet." So that's how we found out.
Great. That's lovely.
And in retrospect, I keep wanting to be like, I should have just said, "Could you walk in this room? Could you just take a step?" Yeah. Because he was like the first doctor we had seen in like a while. And so I was trying to like pepper him with all my questions. Yeah. But he was like literally halfway out the door. You know what I mean? And it just felt so like disrespectful and dismissive. Yeah. That you could tell he was like, "Oh, but I should be doing this other thing." And I just wanted to be like, can you just like put both feet in our room for a second? Because it's a big news that you just told us. Right. That like A, he's spending the night, and B, he might need a procedure tomorrow. Like, what? And so it's so hard when there's these like people who know this information about you and your person, and you don't know it. Right. I think a thing this is newer, this is happening, is that like most of the information we got is that I would get a My Chart alert. Yeah. So I would be sitting there and it would be like, your test results in. So I would log in on my chart and be like, "Oh, your CT scan was clear. Oh, your chest x-ray was clear." Nobody would come and tell us that. I would see it on my phone.
That is wild.
And fortunately, I have enough medical, prowess and background that I could read it and be like, "I know what this means." Right. Or this number's high, but it's usually high, or blah, blah, blah. You know what I mean? But like, that's how we were finding stuff out. Which, I mean, in a way, I'm glad, because we were getting it like right away. Yeah. But also it's like, what? What about the people who are just like stumbling into the ER and they don't have My Chart set up, you know? So that's how we found out he was staying over. Oof. So I was like, "You're like admitting him?" And he was like, "Well, yeah, but we probably don't have a bed. So we're probably just going to like observe him and and it's like, what is happening? So, I mean, a good thing is that he didn't feel terrible. Right. So once he got there and got fluids and started getting some IV antibiotics, he started feeling better. Okay. So that like was a very different piece of this that it could have been. Like if he had been miserable, right? It would have been different. But I think just the fact that he was like mostly just like chilling, was fine. Yeah. Like helped a lot. And still it was terrible. Like, because then at one point I was like, okay, well now I have to tell Maya that he's not coming home. Now I have to decide how long do I stay? Do I stay overnight? Do I go home? Yeah. Do I, is he going to be okay? Do I go home to be with her? Do I stay with him? All of those pieces, so then spoiler alert, he ended up staying, let's say Sunday, Monday, Tuesday, three nights. Oh, wow. 2 of which were still in the ER. The final night, they finally like got him into a regular room. Wow. Yeah. Yeah. So even at one point they were like, "Oh, you're still on a gurney. Do you want like a regular bed?" Yes. Yes. But I think a thing that somebody realized at one point is like, or communicated, is that like the ER is not like set up for like care. Yeah, you're right. They're set up for like triage. Yeah. And they're not set up for like, at one point someone was like, "Would you like a toothbrush?" Like on a regular floor, they would have been like, "You're staying, here's a toothbrush," right? Right. Well, would you like a washcloth? Would you,
with them being set up for triage like that, if Sean is mostly like feeling okay,
right,
he's not on their priority.
exactly.
Yeah.
Yeah. Right.
Uh-huh.
Which then there's that too, that I'm like, great. Also, can we just go? Like we kept thinking that too. Like, because mostly, so after a while they were like, okay, that's some kind of infection. We just have to wait for it to like grow in the petri dish. I'm like, why do we have to sit here while it grows?
Yeah. Right.
And then they were like, well, we have to, every 6 hours, he needs IV antibiotics. So basically we sat there so that every 6 hours he could get this like 20-minute dose, you know? So I think I want to talk for a second about the decision about like staying versus going.
Yeah.
You know, like me staying versus going. Because I think that's something that I talk to caregivers about a lot.
Right.
And like I spoke to a caregiver because this started happening too. Like people who were like listening to the podcast were like messaging me and being like, I'm in the hospital too.
Oh, wow.
And so I met like a podcast fan who was in the hospital. I mean, her husband was in the hospital and she had slept there every night for 2 weeks.
Wow.
Like, I think she had a cot, maybe, or maybe like a recliner.
Yeah.
Yeah. And so that's a huge thing, right? Is like, Sean was like, I feel fine. It's totally fine. I'm just going to sleep anyway. Just go.
Yeah.
Which is great, you know, but not everyone, you know, especially if people are like not feeling well, if they're feeling anxious or if they're really sick, you know. But I think what's so hard, especially, is when there's like another person at home or people at home.
Yep.
So for me, it helped me make the decision because I knew, okay, Maya's at home. It will help her to see my face.
Yeah.
I'm going to go home. But still, it feels like either way, it feels like you lose. You know what I mean? Like, right. So caregivers, I just want to say, as you're listening, that I think this is a hard one. Yeah. But I think to know, of course, your person wants you there with them. Of course they do. And I think this is one of those, like, I don't know, sprint versus marathon. I don't know. Like if your person like had a ruptured appendix and then it was going to be this 1 night, 2 night thing. And then you were going to go home and they were going to be fine for the rest of their lives. Cool. Stay in the hospital with them. Right.
Yeah,
like,
right.
This is a little blip. Fine. But for those of us who are like in it for the long haul. And like I said, I was like depleted going into this situation, right? That we have to be careful because like this is a long-term thing. And if we end up like this friend, like if she ends up staying there and she's staying there for 2 weeks now. Yeah. Now we're probably on 3 weeks. You know, and so just to think about like just to even get outside of the walls of that place. And to, you know, like every once in a while I would just have to step out of that room and just like walk, which was hard because it was like 10 below. So I couldn't like walk outside. So I was trying to like walk the hospital, but then that's depressing.
Yeah, that is.
But even just like seeing the sunshine because the ER room didn't have a window, you know, and walking, moving, you know, all of those things. And so just like driving away from it was a good thing. Yeah. And just being at home and being in a different space and all of that was a good thing. And so I know caregivers, it's a hard thing to leave your person. Yeah. And if they feel really like they don't want to be there alone, can you think about every once in a while, at least can someone else, like can a friend and a family member stay, just because you got to get out of there sometimes, which I know feels hard. Yeah. So we eventually got home. Okay. I think one thing I will say too is that yes, that did happen that a couple of times people from the podcast or friends, because I know a lot of people who are sick. And so that was a thing that I was seeing other people who are caregivers or who are patients. Like I would be like, I need a break from this room. So I would go visit this other friend of mine who's in the hospital right now.
Oh, wow. Yeah.
But then that was like hard as well.
Yeah, for sure.
It wasn't really a break, you know? And so anyway, eventually we got to come home. Okay. And after like, I don't know, 3.5 days. And so now we are kind of in the after time. Yeah. And so something that I want to say clear is that for a lot of times when people get discharged from the hospital, the work for the caregiver begins then. Yeah. Right. I mean, not that it hasn't begun before, but it's like, yay, they're going home. And often then like the care that all of that whole team of nursing people has been doing falls on the caregiver. Yep. And so I want to say that really loudly for the supporters who are listening, that it's easy to be like, yay, they're home. This is when the caregiver always needs you. They really need you now.
Yeah. Right.
Because now they're the ones waking up on the whatever hour to check the thing. They're the ones giving the IV. They're the ones doing all the things. They're the ones doing the med management. And so you can feel like, oh, they're fine. They're back home.
Yeah.
But for the caregiver, often that's a harder stage, actually, in some ways. You've got the comforts of home, but you've got more to do.
You got a lot more responsibility. Yeah.
Yeah. Yeah.
And you're exhausted from the hospital.
Yes.
Yeah.
Yeah. Yep. So, and then also like in our case, they're like, we would like you to schedule a follow-up with the infectious disease department. I'm like, I don't want to. Yeah. So we are now in the after times.
Okay.
Let's see, today is Sunday and that was Wednesday. So it's just, and again, I think we're fortunate that he feels pretty fine. Like the antibiotics are doing their job. And so there has not been a lot of like extra like aftercare.
Right.
For me, I think it did sort of awaken in me this because we hadn't done this whole ER thing in a long time.
Yeah.
This whole like, oh yeah, that. Oh yeah, that's a monster that's like around any corner. You know, I kept thinking yesterday, even right now, like a week ago at this moment, I didn't know that was going to happen.
Wow. Yeah.
And so that just feels a little traumatizing of like, oh crap.
Yeah.
I know. You never know what's going to happen, which I like, knew, but because we had fortunately been out of that like cycle for a while.
It's like fresh fuel for your anxiety.
Yeah.
Yeah.
Didn't need that.
No.
It was already fueled up enough.
Yeah.
So that just feels a little like, oh, like another thing to be like, oh yeah, that's a thing that can happen at any point and just derail everything.
Yeah.
You know? I think I'm also, go ahead.
I was just going to say, you must be exhausted.
Yep.
That's to go through that ER stay and just the lack of, because I imagine you come home from being there and I mean, nominally you can rest, but your brain is still over there. Your adrenaline is probably still going. Like you're getting some amount of rest, but it's not like you're not recovering.
Right.
You're still in it.
Yeah.
And so I can imagine that. And thankfully, because you don't have a lot of additional like stuff to be doing now that you're back home and Sean's back home from the hospital, I can imagine the crash could be pretty intense from that. And so I guess, how do you manage, how have you been managing that alongside, because you also can't just drop everything and just lay on the couch and rest and, you know, take off from everything.
Right. I did like clear my whole week. Like once I saw that this was happening, I was like, first I was like, I'll clear a day. And then I was like, I'll clear 2 days. And I was like, nope. The whole week. And I want to say loud and clear, I know I'm very fortunate that I can do that.
Right.
Being my own boss. And that I'm in the caregiver space. And so they get it. Right. So I cleared the whole week, which was great.
Yeah.
One thing I wanted to go back a minute and say is that like because at first I was like on adrenaline. Yeah. In the ER situation. Right. But then one of those days, especially because they kept saying, well, he'll go home tomorrow. Yeah, he'll go home tomorrow. Yeah. He'll go home tomorrow. And so one of those days I like was crashing there. And I was like, I cannot be in this space anymore. And fortunately he was like, go home, just go home. It's fine. And I thought I was going to go home and be able to go back and pick him up and take him home. I was like, I can do that. I can just do that. Yeah. But then he called and was like, I have to stay another night. And then I was like, okay, I'll come back and visit you again tonight. And then I was like, I cannot. Yeah. And so again, this was this really hard thing. It wasn't just like going home to sleep. It was like the middle of the day. And so it felt like for sure I should be there, but I was so done. I was just done, at my core. Yeah. And so again, fortunately he was like, no, it's fine. He's like, I'm just sitting here. Yeah. I'm fine. You stay home. But I mean, that was a hard decision. And I even thought like, what will people think that I'm not there? And yada, yada. But like, I just needed it, So in the days since, yes, like total exhaustion. I have found yesterday, I kind of even found I was almost like shaky because I think it's like the adrenaline came down and then it was sort of that like, what just happened? You know, kind of thing that was happening. And it is hard because like, even though technically in a lot of ways I can just like lie on the couch, it feels like that's not who I am. You know what I mean?
Yeah.
And so it's hard for me to be like, how much can I just lie here? You know? And then also, so I'm just trying to find all the ways to like be so kind to myself and like what does my nervous system need?
Right.
You know?
Yeah.
And so it's like, I've been using a lot like the heated blanket, and I found this like meditation that I really like that like walks through, it's yoga nidra. So like walks through every body part and you like relax every body part like at a time.
Yeah.
And not pushing myself and you know what I mean? And like drinking all the water and just trying to do the things.
Yeah.
To recover. But I think like now it also is this like, it's this pressure of like, I want to recover, but also I need to recover because it's going to happen again tomorrow. You know what I mean? Like now I'm sort of in that mindset.
Yeah.
Which is hard because am I catastrophizing? Maybe, but also there's data to show.
Yeah. Right.
Right. So yeah. So like this week I'm kind of slowly getting back into things. And we'll kind of see. Sometimes that helps, but I think I need to remember that like, even though he's like up and around and moving fine, like we just went through a really big thing.
Right. Continue to be gentle with yourself in the next week. Yeah.
Yes. For sure.
Yeah. So another piece of this, I imagine, is hopefully you received support during this period of time. And so I'm curious, is there any specific ways that you were supported that would be good to share so that our listeners who are supporting caregivers in their lives have some ideas or kind of know a little better what would be good in a time like this?
Yeah. No, I mean, I'm so fortunate. And I mean, part of it is like, part of my gig is like teaching people how to support caregivers.
Yeah, right.
And so then I benefit from that, which is amazing. So I think the whole range of, you know, like a Caribou coffee gift card or a DoorDash gift card to like supportive texts like you send so beautifully, you know, that just sort of acknowledge like, you've been going through this for a number of days. I'm sure you're tired. Or I'm here with you. No need to respond. Like beautiful, you know, like with the no need to respond thing. I had one friend who gave a little laundry list of ideas, which I loved. He was like, can I bring you some food? Can I run to the store? Can I do some things around your house? Can I walk your dog? Is there something else? And I was like, you know, if you could go into my house right now, I would love that. And I will tell you a couple of things. And so he was like, great. And I was like, fill up the dog food thing, do this, and he just came over, did those things and left. And it was great. What else? I think food, like people have dropped off food or flowers. One thing I did realize is that even for Maya, that she just saw this like soup and flowers coming in the door and was like, how serious is this?
Oh yeah.
And I was like, oh yeah, good call. Okay. Right. I was like, we just have a really supportive community. And so that's why this is happening. But like, it's not as dire as it looks by the flowers that are coming in the door. Even like I can picture a moment. So my mom like did a CVS run for me. And then she was like, whatever you need, you just call. Right. I will be there. You just call. And it was like so sincere that I was like, okay, yes. Okay. If I need something. And so like those kinds of things, you know, are just like, so like the stuff of the getting the stuff done. And I think a piece of it is like remembering even the piece about like someone who had like emailed me and said like, hey, can you help me with this thing? And then saw what we were going through and then emailed again and said, just kidding. Like ignore that email. Like no worries. You know, I think because I'm in such a helping role and that I think that some people then recognizing like, hey, I'm in a helping, like I maybe don't have capacity for that right now.
Yeah.
And I'm proud of myself that someone texted me at one point and said, I'm about to go have coffee with a friend of mine who's a caregiver. Can you give me some tips? And typically I would be like, oh, I'm so glad to do this. But I said, I'm so sorry. I don't have capacity for this right now. But it's a person who I know has listened to like every episode of the podcast. I was like, you know what to do.
Mm-hmm.
Listen, don't brightside, say this is hard. You know it, So I was proud of myself for setting up that boundary, because I think that's something that's been really hard, is that I'm such a helper that even in these moments I want to help, but I really sort of need to like not. Yeah. Which feels hard.
Yeah, for sure.
But I think I just need to not, Yeah. Yeah.
Is there anything else from this experience that you think would be good for our listeners to hear, or that you want to say?
I think sort of the overall is like, I think just the piece about like, you don't realize how you might think that you're just like sitting there and that it's like, all I'm doing is sitting by the bedside, but that and then for supporters to hear this as well, that like, that we are on, that we are like watching the patient for symptoms. We are listening for everything. We are advocating that, all of these things, and that like, there's so much energy, I think, that goes into the role that we play when we're sitting there in that hospital, and then absorbing sort of the energy of the hospital and the ER and the noises is like so much as well. And so I think just like not underestimating that. Yeah. And the toll that can take, is big. And so to sort of give yourself that, like, yes, of course you're tired. Yeah. Right. It looks like you're just sitting there, but like, really you're like on high alert and you're doing all these different things, even though you're sitting there. So, yeah. I mean, that makes me think of the last time that Sarah was in the hospital. I mean, it was a couple years ago or a year ago. I don't remember exactly. I mean, I know we talked about it on an episode, but it would, because of COVID, I couldn't go. Right. I mean, you were in the car, weren't you? They let me stay through triage. Okay. And so I could convey as much information that I could at that point. But yeah, then I went to the car. Yeah. And until at, I don't know, like midnight or later or something, I think Sarah called me and was like, I'm going to be staying. And so I was like, okay, I'm going to go home. But hearing you talk about like all the stuff you're doing when you're sitting there. Yeah. And that she didn't have that. Yeah. It must have been how much more stressful it was for her. Right. To not have the person has been there with her through these medical appointments that she can lean on to know the things. Yes. Yeah. Yeah, exactly. Exactly. There's this really powerful piece of art that a friend of mine drew for me after that COVID time when I had to drop Sean off at the ER. And it's sort of like, it's a picture of like him being taken off on the gurney and me at the door of the ER outside. And I have this bag over my shoulder. And on the bag, it says like advocacy, comfort, knowledge of, of pain levels, like all of it, essentially all of that we carry as caregivers that was outside. Right. And you think about how much harder, yes, that was on patients, but then also on the staff during all that time that they had to try to figure all that out. And so it just shows like what an essential role we play. Right. In those moments for our person and for the staff. Yeah. And why we're so tired and why we need support and to be seen, So it's like all of that is so hard and so big, and we're still not really like seen and respected and cared for. You know what I mean? So yeah. It would be interesting if you asked her about that, asked Sarah about that, like how that might have felt differently, because I would guess that you were often her voice in those situations, when she's not feeling well. So yeah. Well, thank you for the therapy session. Oh, you're welcome. Good to sort of process all of this. And I hope that, I'm sure that I would imagine a lot of our listeners are just like nodding as they're listening. And I wish that they weren't, but so again, listeners, you can think about if you have to do hospitalizations a lot, or even just not a lot, you could send this to your people and just say, hey, this is what it's like. And I would imagine the people who are taking care of littles, like if it's your kid in the hospital, it's like a whole different thing. Right. So, Sean's a very compliant patient. Right. Yeah. But if the person had dementia, or if the person was a child, like that, I can imagine this is a whole different thing. So, potentially send this to your people in your community to say like, here's what it feels like, or here are components of what it feels like when you're in the hospital. So I hope that the next time we talk and you say, how you doing? I can just say boring. Right. Well rested and boring. That's what I hope for the next 2 weeks of my life. Let's Fingers crossed. Did I just jinx it? I don't know. No, you didn't. Not at all. Always good to talk to you, friend.
Yes,
Thanks for listening and
thanks
all
for
the care
sharing.
you provided. And all right, we'll see you soon.
Okay, sounds good.
Bye.
Bye. You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to insicknesspodcast@gmail.com. If you enjoyed the show, please share it with a friend or fellow caregiver, or leave us a review on Apple Podcasts. Thanks for listening, and take care.